The purpose of this project is to evaluate the effectiveness of text messaging and social media platforms to address the mental health needs of LGBTQ adolescents. Research shows that sexual minority youth and gender minority youth are at greater risk of suicidality and mental health symptomology compared with other groups. Since youth in these categories have greater negative experiences, programs and practices should develop interventions to alleviate these concerns. Transgender and sexually minority youth experience more trauma, violence. They present with greater mental health needs and have higher rates of suicide and suicide ideations. Suicide is the leading cause of death in teenagers and youth and young adults. This research aims to assess the feasibility of meeting the mental health needs of LGBTQ adolescents via texting. There are significant barriers that prevent LGBTQ youth from seeking crisis interventions, which results in increased suicide rates. Social media platforms are being utilized as research tools. The Jahinsky and Durkheim project's social media studies have implications not only for research on suicide, but how clinical practice in their methodologies enable real-time monitoring of text content found to be predictive of tendencies towards suicide and other self-harmful behaviors. Research shows a clear need for mental health and psychiatric services to address the needs of transgender, gender nonconforming, and other sexually minority youth. Minority stress theory is the leading framework for explanation regarding mental health and suicide disparities between youth who are not from sexual and gender minority groups. The theory recognizes stigma, prejudice, discrimination, and victimization from a homophobic culture as instrumental factors in mental health problems among sexual and gender minority youth. And that was the result of the Fognini study in 2020. This study, however, was conducted over the course of a 6-month period between November 2021 and April 2022. My study was conducted using quantitative single study research design method, and I had an experimental group and a control group. There were approximately 150 participants that were interested in the study. Our study selected only 18 youth that identified as LGBTQ youth. There were 9 participants in each group. Study participants were screened for suicidal ideations, and those with a clear plan or ideation received immediate mental health or medical treatment. Selected participants completed the suicidal ideation attribute scale at the end of the research project. Based on the results of this study, the following information was determined. There was a decline in suicidal ideation that was noted amongst the participants that received the text message intervention. My null hypothesis was that the LGBTQ youth adolescents will not engage more in seeking mental health services in a crisis via texting than in in-person sessions. My alternative hypothesis was that LGBTQ youth adolescents will engage more in seeking mental health services when they're experiencing a crisis. Based on the research, I am able to reject the null hypothesis. My study results were positive and they're worthy of further exploration. There were noted benefits of texting significance towards the LGBTQ youth when seeking crisis intervention. There were decreased suicide ideation amongst the group who participated and received the text message compared with the other group who did not. With previous research, there were limitations to this study. My sample size was relatively small, and therefore additional research is needed before generalizations could be made across all demographics and regions. This study excluded youth who identified as heterosexual or who were uncertain and did not actually have a label. So therefore, it would be hard to make generalizations because our study did not address the impact texting would have on other individuals seeking crisis and mental health services. Continued research is needed to explore ways to decrease stigma, promote diversity, and to develop evidence-based programs to ensure providers are able to meet the needs of transgender and gender nonconforming youth. This research supports texting and other social media platforms for youth in crisis. Advocacy programs that promote and assist with parental support and involvement in mental health treatment of sexually minority youth is strongly recommended.